Thanks, Brad. Okay, let me share my screen and get started. Good morning, everyone. A very warm welcome. So today we are going to talk about key programming strategies for effective outcomes. We'll be discussing about all of that and what we have been discussing throughout the series. But before that, today's agenda is we will again go with a quick round of introduction so everybody knows everyone else. We already know, but Dr. Kim is here. And so in the next agenda, she is going to talk to us about FCS. She's going to give an overview. And as we all know, she is coming in as our new Associate Dean for Extension, which is exciting. And I became selfish when this announcement went out saying that, oh, are you going to be on our POD series because you are scheduled to talk? And she is so nice. She kept her promise and she's here. And then we will talk about different programming strategies and we will focus more on the outcomes and how we are going to get that, how we should be able to measure it. And we will talk in length about different components of logic model, how we are going to apply that, and how we are going to measure. We will also give you resources and let you know that we are here to troubleshoot in case you have some questions on that. So now moving on, we will definitely go around the room and I'm quickly going to stop sharing my screen, but just wanted to share some more slides before I do so. And then we have Dr. Kim scheduled here, and then we will go to the pre-programming strategies. So now let me stop sharing my screen and we will go around the room and introduce ourselves, tell about the program that you're in, which county or place, and how long have you been with us. Let's start the way I see it here. Jackie.
Good morning, everyone. My name is Jackie Takis. I am the Watershed Restoration Specialist in Southern Maryland, housed at the Upper Marlboro Research Center. I am also the Appointment, Promotion, and Tenure and the Appointment, Evaluation, and Promotion Coordinator for the department. I have been with the university for going into my 32nd year and with extension for 28 of those years.
Cool. Thank you. Second, me. I'm Debasmita, go by Deb. I'm the Program Director for Evaluation and Assessment, and I have been with UME for the last 7 months, but I have been in AGNR for a long time than that. Next is Jeff.
Good morning again, everyone. So I have the good fortune of serving as the unit head for program and organizational development, which of course includes, we have kind of 6 big buckets, but one of those, of course, is evaluation and assessment. And we're in great shape with Dr. Patra being in the lead with that and other components. But I also serve as one of the assistant directors with the senior leadership team of Extension.
Thank you, Dr. Howard. Amanda.
Hi, I am Amanda Hawkins, and I've been employed with Extensions for about 6 years. I've been in this position since January as program leader and educator in Allegheny County for SNAP-Ed.
Thank you, Amanda. Catherine.
Hi, I'm Kat. I am with the Aquaculture Extension team. Just an agent, associate, and I work with land-based Atlantic salmon systems. So some of you might have seen it in the news. It's kind of big right now. And yeah, I don't know what else to say. I'm blanking. I apologize. So I'll just hand it off.
And
No
one quick hop in, Kat, you're never just okay? It takes all of us to
Exactly.
carry out the amazing work of this organization. So we're proud for the role you're in. Thanks.
Yes.
Thank you.
Yes. Welcome, Kat. Thanks for being here. Kathleen.
I'm Caitlin Balagush. I came on to Extension last year as a staff program assistant for the Master Gardener program in Charles County. And then just this past August, I shifted into the faculty agent role for that position.
Awesome. Thank you. Kelly?
Good morning, everyone. I'm Kelly. I'm an ag agent in Montgomery County. I've been in Montgomery County for 2 years, but I've been with Extension for 5 or 6 years now.
Awesome. Thank you. Joy?
Hey there, everybody. I'm Joy Vogan, and I am the SCS educator in Frederick County, and I am new to this position since 1st of July.
Awesome. Thanks, Joy. Dr. Kim?
Jenny Kim, program leader currently serving as a program leader for FCS.
Thank you. Yeah. Doris?
Doris Benke. I'm in ag, home horticulture, and Master Gardener Coordinator in Cecil County. And I've been with the university for 12 years.
Awesome. Thanks, Doris. Brad?
Good morning, all. Brad Palik. I'm a education technologist for the college, located in Simons Hall, but I serve the whole college. I've been with the college for 7 months and 34 years.
Awesome. Thanks, Brad. Gabriella?
Hi, I'm Gabriella. I am with Maryland SNAP Ed in Prince George's County, and I am a nutrition educator. And I've been here a year and a half now.
Awesome. Welcome. Dr. Walker?
Good morning, everybody. I'm Nicole Walker, and I'm the Evaluation and Reporting Coordinator for Maryland SNAP Ed. And I have been in my current role for about a little over 8 years now.
Awesome. Welcome.
Thank you.
Charles?
Morning, everybody. I'm Charlie Sasser. I'm the Ag Marketing Extension Educator for Prince George's County, and coming up on 2 years. Started in November of 2020.
Awesome. Welcome. Madeline?
Good morning. I am also a nutrition educator for SNAP Ed in Prince George's County, and I'm a registered dietitian. I started with Prince George's County in November of last year, so it will be a year this November for me.
Awesome. Welcome. Elena?
Good morning. I'm Elena Santiago, and I am the evaluation analyst for Maryland SNAP Ed, and I've been here for a little over a year.
Cool. Welcome. Erin?
Good morning, everyone. I'm Erin Dewar. I'm the Assistant Director for Maryland SNAP Ed program, and I have been here for about 13 years.
Awesome. Welcome. Welcome, everyone. Did I leave anybody that I didn't call out? Doesn't look like so. Okay. Thank you, everyone. Now it's over to Dr. Kim, and I think you can share your screen and go ahead with your presentation. Thank you.
Okay, thank you, everyone. Nice meeting you all virtually. And I guess the biggest is if I can share the screen correctly. All right. Do you see this view or no? Brad, am I in a...
We're in the edit. You're showing the edit mode right now.
Edit mode. Okay. So let me see if I can change it.
Jinhee, you could also start it and just, there you go. That looks good.
Okay, thank you.
Well done.
All righty. So good morning, everyone. Thank you for inviting me, Deb and Jeff. It's a wonderful program. And I agree with Jeff about each of us is important to the organization of the University of Maryland Extension. And I'm so excited to share some of the updates about FCS or the programs of the FCS. And please, Deb, feel free to stop me because I'll talk a long time and I don't want to take over your training. I probably am I may do it. So please do not hesitate to stop me and tell I'm talking too much, which I tend to do. So for the
Dr. Kim, I think I own that title. So I don't know.
I don't know. I'm not sure. My kids will disagree with you. So for the FCS, I'm going to share some for the FCS programs. As you can see, we are about the healthy people and healthy communities. So for the FCS programs, really what we are trying to do is ensure all Maryland residents are healthy and economically successful at every stage of life through education, research, and outreach programs. And some of the priorities groups, and then some of the programs we work through the SNAP-Ed I'm going to show next. So here we are. So for the goal of the enhancing health and well-being of all Maryland residents every stage of life, as you can see, we have a SNAP-Ed and FNEP program, federally funded nutrition and health programs, very successful, leading the nation as a successful statewide programs. Also, within the FCS programs, I will be focusing more on today's presentations, nutrition and health and wellness, food safety and preservations, financial capability and wellness, and health insurance literacy. And then you can see at the bottom, mental health and well-being, cross the bar, crossing all program priority areas of the FCS, because that has fundamentally affecting, it is not just the mental health is a part of the health and well-being we are trying to accomplish as outcomes. Also, they are impacting our programming and nutrition and health, or the food safety, financial capability, or health insurance literacy. So that's, we have at the bottom, the mental health and well-being. It's not, we don't have a priority group yet, but it's working with all priority areas of FCS program. Currently, we have for these strategic goals of 5 years, we set in 2020. So some of the, we had a listening sessions, SNAP-Ed and FNEP, and our external advisory council members and our own faculty. We thought through this process, and we really thought about the strategic goals of 5 years where FCS is going to prioritize. These are partnerships, interdisciplinary approach, equity that includes diversity and inclusion, and then some of the innovations and diverse learning methods and expand capacities. But as you can see, we did not do this prior to pandemic, but we had to expedite or change some of the priorities because of the pandemic. But these are the 5 strategic goals that we are working on. Our faculty members are around the state. You just saw our newest member of the Joy Bogan, who is in Frederick County. We don't have a large numbers, but addressing clusters around the state, you can see Jesse Ketterman and Lisa McCoy from the Western Maryland to Baltimore City, Michael Ilonge, and Crystal Terhune in the Lower Shore cluster. We currently have 4 open positions. We not in search, but 2 tenure track positions in St. Mary's County and Wicomico County in nutrition and health track, and in Worcester and Frederick County that finance and wellness, well-being positions as a professional track faculty. So we currently have some vacancies, and we have 6 specialists, but serving around the state with this strong faculty. For the nutrition and health and wellness programs, I just wanted to highlight some of the highlights. A lot of our programs focus on the long-term objectives are sustainable, community-based chronic disease and prevention management is some of these highlighted programs here I want to share. DASH Plus is a dietary approaches to stop hypertension programs. So that includes some of the produce delivery, as well as a nutrition and health education, and also blood pressure monitoring, working with some of the nurse practitioners that in our team. So it is really integrated approaches to address hypertension, but it's not just a nutrition. Dining with Diabetes is a national programs for the adults with the or at risk for the pre-diabetes, diabetes, and type 2 diabetes. So these are some of the programs we've been doing around the state. And then Fresh Conversations with the older adults. We've been there for 44 senior centers around the states, working with the seniors that's to enhance their health and nutrition as well. So we have different modules in person, as well as trained trainers of those senior centers around the state. So we have a general nutrition and health programs, but these programs really highlight the statewide programs addressing the chronic disease prevention and management. Our food safety and research and outreach and education has been led from, as you can see, from the farm to table, from the farm producers, processors, and as well as the consumers, are all spectrum that we are addressing. So we have we don't have a large teams, but we have successfully secured the grant and working with closely with the agriculture folks. You can see the Maryland Food Ventures working with the agriculture and some of the food safety training for the workers. To the consumer side of it, food preservations, you can see grow it and eat it, preserve it, and also kitchen kaizen. So we work around the spectrum from the farm to the tables to the consumers in food safety issues, but we're strong in also consumer food safety. For financial wellness team has worked on various trainer type of programs, and that we have recognized, we have some national award-winning programs such as Master Money Mentors program, personal finance seminar for professionals, housing and eviction prevention programs, as well as the other various types of programs for managing financial management, but also really wealth building and then successful the wellness programs as well. So we have worked with also strong youth programs with the 4-H, such as Smart Sense programs and Smart Sense programs and various camps, and the youth programs are working with the 4-Hers as well. For the health insurance literacy is our signature program recognized by the University of Maryland Extension. It was the first signature program within the University of Maryland Extensions. Various programs started with when the ACA was passed, about when Affordable Care Act has passed. There was a lot of questions that how we can help people for the first time to selecting the health insurance or the management of it. We started that. Now we're moving into various topics as a smart actions, managing and also resolving the conflicts, working with the to access the using the mental health benefits, or working with the seniors or the agriculture and the farmers and farm families as well. So that's some of the programs we have with the health insurance literacy. For the mental health programs, as you see that we have various programs about the grief, stress management, healthy relationships, and then rural opioid and behavioral health through the grant-funded projects, and then expanding the work and partnerships with the farm stress, some of the work with the medical professionals or the healthcare professionals related to the stigma reductions or the seeking help for themselves, and also navigating insurance for the mental health care. So for some of the highlights, I wanted to show is the farm stress management. It is the FCS as well as the agriculture as educators work together to address the farm stress, and it resulting offering some of the therapies, free therapies for the farm families as well. And for some of the additional programs we offer from the adults at the Justice Consumers to the trainer models, as well as some of the youth programs we have done to address the mental health and the behavioral health issues. So just a quick summary of the UMass data from the our 16 educators we have, not including some of the grant projects with the Rhoda and then other projects, SNAP-Ed or the other projects. For our FCS educators in a direct context, about 13,000. Good balance between 34% youth and adults, 66%. And then gender differences, 64% and the male. We're really working hard to recruit the male participants in our programs, and that's our goal. As you can see, some of the topics generally produce more interest among the female participants. Some of the ethnicity and the racial breakdown, we're quite doing well in terms of the Black participants, Black African-American participants, but we're working on the Latinx groups, only 9% serving. So that is some of the limitations we have in terms of the Spanish-speaking faculty within the FCS. And we serve around the counties, seeing that some of the St. Mary's and Caroline counties, we had more people than others, but serving around the counties with more work need to be done in certain counties, so we are not reaching a lot. And the number of classes with the 16 people, 469 classes, and all different areas, the priorities that I mentioned, financial wellness, food safety, health insurance, health literacy, and some of the nutrition and health and wellness programs. And the different methods we have used, as all of us have done with the in-person classes, but as well as sometimes we have to provide the one-on-one consultations and then in service as well. I just wanted to show some of the breakdowns of the methods and the location of the programs, a lot with the community centers and buildings. And we are less likely to offer it within the extension office because of the audiences that we're trying to reach. And some of the Rhoda, Rural Opioid Technical Assistance grants, some of the breakdowns are, we're very proud that we have trained over 861 mental health first aiders that around the state that really can help and diagnose and then provide help with the mental health crisis in Maryland. And some of the other projects I wanted to mention are interdisciplinary or multidisciplinary projects that Deb suggested I include is we have done a lot of work together cross programming, have the living programs with the youth. We have done years with the 4-H and from the finance, mental health, positive youth development, and the nutrition and many more. Some of the farm stress work, food safety and food preservations, and also well-connected communities. When we reach out to communities, they just don't have issues with nutrition or chronic disease. They have we really need to understand the needs and the communities, how well we best serve in the communities with the diverse needs. And then often we need to bring extension programs together, not just FCS or not even just on one nutrition programs. And the mental health and well-being is a really cross-cutting all program areas affecting our own faculty and staff or our clients or as well as our partners. And there is a great opportunity for us to work together. We have some new projects that we wanted to share we learned this lesson with the Excite project is immunization education, but we really wanted to work with the agricultural workers and we focused on the Latino and the Creole, Haitian Creole speakers, agricultural workers within the Maryland. So a lot of learning and insights that we want to share and then findings that we can apply into other program areas that we have gained a lot of the expertise and learning lessons learned from working with this group. But though this project wouldn't be successful without the partnerships with the agriculture and then ENR educators. Some other programs we wanted to highlight CIFER grant with the 4-H successful programs with the Casa de Maryland in Prince George's County. It is the family life educations, positive youth development, and the mental health, as well as the youth physical activities, soccer classes, soccer lessons. So it has been very successful. And we're going to offer programs again in the fall, but this is like how all pieces together to address the communities in the Casa de Maryland, but it could be applied and replicated into many other parts of the state. Another opportunity is about the digital literacy program that we all learned. We had to teach probably 20% of our time of our clients or our class participants about how to connect to Zoom or how to fix the issues. So digital literacy and addressing digital divide are really affecting a lot of our clients, a lot of our participants and partners. So we're hoping this is another opportunity to work together. It's not just the FCS program, the all cross programming areas. So this is the end of my slides. And
wow, that was a brilliant presentation. Thank you so much, Dr. Kim. And let me give this virtual clap that I do for everybody. So we have that on record. So thank you, everybody. And if you have any questions for Dr. Kim, she would be happy to answer. I did see 2 comments coming from Kat. So Kat, would you like to talk about it?
I mean, I just put it out there. It's not related to our extension work, but so I moved from Maine where opioids are just such a big deal. I was very close before I got this job. I was actually getting ready to have training myself. And in Maine, and I didn't realize everything that seeing that presentation was great. I didn't realize the extent of all the work that happens, and opioid was not one I thought that would be a part of that. And so I was just curious in general, what is Maryland's general status? Like the town I lived in, every city councilor had the training and carried Narcan on them so that they can administer it to anybody. Like if they were out in public interacting, someone was unfortunately overdosing, they could treat right then and there and like call the police. And I know that's a very proactive town council, but I guess I just don't know what the status is in Maryland, being so new here.
Kat, thank you so much. Probably I'm going to take my answer a little bit too long for your questions, but I wanted to just say this. I mean, there is a lot of efforts we're doing, the harm reductions, and then what efforts are doing. Sometimes it's more controversial, all of those, but not without going into details. It's always looking at the nationally. There is a rural opioid crisis and an extension responded. There is the report the National Work Group put out. So when I started the positions, there was interest and there is a lot of questions. What do we do in Maryland in opioid crisis? But what is the role of extension to address those opioid crises? So when we started, we looked at nationally what other extensions been doing. So I think it's always a cheat sheet. Extension is a great system. So if we are having issues, I'm sure there is other states dealing with similar issues. So there are smarter people out there than me. I'm sure there are some answers and ideas being tested or shared. So there was one thing, and then also there was a grant opportunities. But when we did the needs assessment within our system, it was like 2019, when we talked to some people and extension people, there was an FNAP educator. She's no longer with us, but she was in Western Maryland. She said 7 of her clients had overdosed in that past year. So it's affecting our participants and our programs and how we best respond to that. Thinking about there is a community needs and what the communities want. We can't just come and then say that this is extension, this is a program we are going to offer. But there are also looking at the community levels, but at the same time, the national level, we can draw the expertise, but really extensions are all integrated, deeply rooted in the communities. So always asking within ourselves, within our expertise, we're asking what will be the best responses. But there are different movements, but I can tell you a little bit more about that, but about in different settings. But I think it's the community needs assessment and what Deb and Jeff will be talking more about how we develop extension program that unique meeting the needs.
Awesome. Thank you so much, Dr. Kim. And we have Dr. Kim's email address and mailing address in case you guys want to reach out to her or ask further questions. She would be open for that as well. So thank you very much. And yeah, there we go. So now we will go ahead with our agenda and we will start talking about all the different components of logic model and why we use it, what are those things. But before that, nobody now can say that they haven't never heard about logic model. So let's get started with understanding that. What is a logic model? We will have, we can have a quick photo as Brad is writing. So yes, Brad.
Do you want people, if people, can you turn your cameras on for one quick second, second. If your camera's not on, Deb would ask a quick photo op. So if your video is not on, give me another couple of seconds. Getting
Brad,
there. Yes.
Can you give 1 minute?
1 minute, I can. I'm not sure. You bet. Thanks for your patience. We know who asked that and when that 1 minute is up.
It's me. It's Erin.
Okay, Erin. Thanks.
I'm tending to my motherly duties. Here I am.
Okay. Hold on 1 second if you don't mind. All right, appreciate that. Thanks. Thanks, Deb.
Okay. Well, thank you, Brad. Thank you, everyone. Okay, so now let's get started talking about logic models. So what is a logic model? I know people are here, those who have used it, they have been using it. Some are getting to know it. We have different types of learners here and stages as well. But let's just talk about it. When we hear about this logic model, what comes to your mind? You can just open your mic and share that with us. Anyone?
Don't mean to be too negative, but I do feel it's tedious at times.
Okay.
A
Okay.
little overwhelming at first.
Okay, cool. Okay, no worries, Andrea. You're more than welcome. And do you want to share about logic model? Sorry, I was not picking on you, but anybody else wants to say what it is? If you have ever used that or have intentions to use it. But yeah, we will train you to use it more often now, me and Jeff.
Deb, just to hop in real quick, honestly, of course, I've been with Extension for 34 years. And earlier in my career, quite frankly, I found logic models to be overwhelming. It was a lot to take in and difficult. Every time we would do a grant, we had to do a logic model. And it just seemed like it was so overwhelming. But when I finally, the aha moment for me, finally, was when I thought about literally by title, in my mind, I know where I want to get to, and I know what I want to happen, some change in the people I work with. I want them to adopt a practice or make some change or something is going to happen. And I know I want that to happen. So then I logically map out a process that will get me there. And so that's how I kind of finally while it's overwhelming to think about, it's really putting it into manageable steps that will lead to this outcome. So I finally just took literally the title of it. Well, it's just a logical approach that I'm going to take to get where I need to get to. So
awesome. Thank you, Dr. Howard. So we have two hands up, first Jackie and then Doris. Jackie?
So just like Jeff, been here for a long time. The first probably 10 years of my career, all I heard was about logic models, and it was one logic model training after another. It was either Extension or Sea Grant or NOAA or USDA. But I will tell you that it's an evolving document. What you put down on paper today doesn't have to look like it's. What's nice about a logic model is you can constantly add to it. I can tell you that I have 2 logic models that I have been using for 25 years. And the nice thing about the logic model is it keeps you focused on what your goal is, what your outcomes are, And it helps you measure your final impacts when you do get to where like Jeff and I are 30 years later, and you have to show impacts. But it's always evolving. And what's nice about it is once you have it written and you've got the verbiage, it really helps writing grants much easier because you've done the work. You've written your situation statement. You can use it from year to year, document to document, and as you evolve in your career, you may reread it 10 years from now, which I do all the time. And I think, God, was I drunk when I wrote that the first time? And you edit it down a little bit, or you make it, or you incorporate the new research. And then 10 years later, you do it again and go, God, I was still drinking, 10 years ago. And you rewrite it again. You make it better. But your outcomes are normally the same, and your impact, your goal of what you're trying to accomplish is the same. And it makes everything easier in the long run. It may seem overwhelming and daunting now, but to have a really simple outline to start with, you'll be surprised 5 years from now what your logic models will look like. So that's just what I wanted to say.
Awesome. Thank you, Jackie. Doris?
Okay, so I come from the PTK side, not the Jackie side, and I have not been here for over 3 decades. So I've been here for 12 years. And I will say that when I first came here, I think we were kind of on the back end of having logic models in each of the program areas, where we had to be on different teams, and each one of those teams would have a logic model. And so when I was first introduced to a logic model, it was after probably a couple of years I'd been here, it was a little overwhelming, but I thought that it showed so much structure, and it showed the stepwise fashion that made me think a little better as to how to put my thoughts together. But then it's like, I felt like we totally went away from that. And maybe I just drifted away from that. But I was even asking the last couple of years in my program leader, I was like, whatever happened to the logic models, and why don't we have a logic model, for like the master gardeners and things like that? Because it just seemed like to me, it would give the overall group of people in that area a similar focus, or something to discuss with each other and work towards. And maybe it's because I'm not a very logical person per se. When it's like Jeff was saying, he thinks of his outcome. I don't think of my outcome. I think of what I need to do up front. What is the best program that I can provide? What do my people need? I don't think about the outcome. I think about that sort of thing. And I know I should, and I'm getting closer at that. But it's just one of those things that I really think that they're very beneficial, especially if you work together on them as a team.
Awesome. Thank you so much for sharing, Doris. Yes, so we will definitely talk about outcomes and how we are going to use logic model to get there. Now, let me share my screen. And today we are definitely going to discuss even more in depth what the components of logic models are. And this is always for a change. It's not that you came up with a model and it stays forever. It goes on as Dr. Howard mentioned and Jackie mentioned, it goes on to change. After a while, you have different programs coming, different knowledge being gained, and there are research and data which is coming to support different components. And we constantly change those models as well. But when you have a logic model, you see the blueprint of your project starting from the needs assessment to the measurement of your outcomes in one place. And then you can troubleshoot yourself. If not, we are here, of course. So let me go ahead and start giving you definition of logic model. We'll go with the formal definition as been Corbin and others in 2004, which has been very frequently used, which says logic model identifies explicitly the components of a program, beginning with the expected impact and following with the resources, activities, and target audience participation in order to determine the plausibility of the program in achieving the impact. So we are always taking baby steps to first discuss about or define what we are thinking about doing. and how we are doing different activities to achieve that, how we target our audience participation. We need people to come to our programs. How do we do that? And at the end, how do we show an impact? So measuring impact is always the tricky part, as we have seen, and some of you have already shared. But if we do not show that and consciously do not build into our programming, at the end, we won't be able to show that impact on paper. And we know as extension agents, we do have a lot of ideas. We come up with that fire, like we are going to change the world. We are going to change the way we reach out to people and the way we do the programming. But how do we measure that? And how do we streamline our thoughts into these doable, resourceful activities leading up to the impact? Okay, so in short, what do logic models do? They help us in program development planning, implementation, how we are going to implement something. We came up with this plan, and if we cannot implement it, it's not going to work. So that is not probably the best logic model. And these models are not given. Sometimes you know the components and you are going to build that up. That is probably a template. What are the things that you should be considering? Not necessarily somebody said that, okay, I have done A, B, C, and D, and I have gotten this kind of impact. But not necessarily it's true in your case always. Your society changes, the community changes. The way we do programming, that also changes over a period of time. And so we would also see the logic models evolving. If you see the history, it started out with a very simple logic model guided by different theories. But then it took different twists and turns, and people were unable to contain that types and varieties. So they came up with some models of logic models. Common measures kind of thing, where you can adapt to some of these models, but not necessarily it's always going to work for everybody. So you are be your own judge. You try to develop your own model. We can give you all these templates and the resources, but developing the models is on you. Then how do you manage the program? Once you have come up with the design, you have started implementing that, how do you manage? How long you are going to implement that? Do you have a timeline? And all those. Consensus building. So when you have a logic model, you already are aware of different kind of activities that you will be doing, the communities that you are going to approach. And when you have this already all these resources in front of you and the components, you start about this consensus building, that process that goes on parallelly with your program development and implementation. And effective communication with the stakeholders. We first would identify the different stakeholders that we would be reaching. And then how do we effectively communicate with them? Are we going to talk to them in person? Are we going to make a phone call? And if they have some questions about our programming, before even we implement, can they reach out to us? Can they ask those questions and then participate? So these are very important when we have a logic model. We know where to troubleshoot. And then identify program outcomes. So as I was saying in the beginning, we have different ideas, but the question is, can we do it effectively? Can we measure it successfully? Can we, at the end of the day, show that this is the impact I have on the society? That's what we are going to work on, so that we include all these components starting from the models. And then we go ahead and get those measurements and think through your plans. So you have a model, you came up with that model considering different components that I will be sharing in a little bit. And then you say, okay, is this the way I should proceed? Should I be changing some of the components, making readjustments, or I went to the field and I didn't find very good about one component? Can I change that? Yes, you can. It's again, logic model is very flexible. This is exactly the way you decided you will be doing to achieve your goals. So those are some of the good things about the logic model. Okay, now when we talk, and this is probably a little intimidating, but this is, I would say, very simplistic and gives you all the components and tells you what it includes. And we do have these templates provided by USDA so that people wouldn't go, I remember Jeff saying about when you write a grant, you would need, yes, in some of the programs that USDA NIFA has, this is a required component. You have to, submit this logic model. One, they're making sure that you are already aware what you are doing, very well know what's going on. And then they also, to help you out, they throw in a logic model template so that you just fill it in. Well, now let's go slowly through all the components. And as I'm saying, 1,000 different ways, there is no particular way of developing a logic model. There is no established model that you would say, okay, I'm going to adopt this one. You are the one who would be taking care of all these components. So let's start with the situation. So situation is more like, what are the needs? What kind of situation is in their field, the community, the society, which actually lets you decide what kind of programming you would be doing, what kind of programming you will be interested in, given your expertise, the place that you are in, the type of communities and other kind of issues that have been existing. You would decide on that. Under priorities, as they say, you consider what's the mission, what's the vision, what are the values, are there some mandates, do we have resources, what's the local dynamics, and do we have collaborators, competitors, and what we are looking for at the end of the day. So if we unpack, what it means is there are 1,000 different priorities in a community, in a society at a given point of time. Which one do you choose? And if you choose that, why, how? Those are the questions that you would be answering. And it's very broad. When you start out, you have different things that are going on in your mind. Oh, I can do this, I can do that, I can change this part, I can make my programming stronger and that. But always it's a good idea to come up with one and focus on that and take your baby steps. So you decide on, given the resources that are available to you, given how you are going to approach the community. Let's say if you're new to the place, do you know the dynamics? Who are the gatekeepers? How are you going to interact or enter into that community? How you build that trusted relationship with them? And then to understand the political scenario, what's going on in there, and what you are looking at the end of the day. Then we come to the program action component, which comes with inputs, outputs, and outcomes. What are the inputs? Inputs are what we invest. So we invest, let's say, staff, our time. Dr. Howard, did you want to say something?
Yeah, Whoops, I didn't mean to yell at everyone. Yeah, I just really wanted to hop in quickly. Kind of preempts our gathering next month on October the 6th, because we'll hear from the dean about priorities. But I did want to think about this in kind of practical application as Deb has drawn attention to it. But as she's talking about the priority areas and making decisions about initiatives and where you might find those types of things, everything that's been listed here are absolutely spot on in regard to the reality, especially of how we work in communities, and all of those things factor together. The point that I wanted to raise was, this is why in the college there's initiatives, those very large scale initiatives that the college has, and then within our UME, University of Maryland Extension, and our strategic plan, we have priority areas that align with that. And so some of this work is already done, but that's why as an organization, we make certain that we focus on those. And then that's an area that all of us can go to help guide us, just as the things that Deb has drawn attention to. So I just wanted to hop in and say that.
Sure. Thank you so much, Dr. Howard. I do have that covered as well afterwards. Elaborating on different priorities and signature programs and everything that is going on in our college, and how we can associate ourselves with those. I do have those slides, but thank you so much for including that here. That gives a good perspective. Okay. So now in program action under inputs, it's what we are investing basically. Staff time, volunteers. We are recruiting a lot of volunteers for different programming and activities. How much time we are investing into that, money and resources. What kind of materials we would be needing, and what would be included? Are we going for print versions of different things? Do we have flyers? Do we have virtual flyers and all? And equipment, technology, then also partnerships. It's an input because we are building that over the period of time. So far, based on my experience, I have seen that people never had any issues understanding what inputs are, priorities, or situations. The most issues that come with is the outputs versus outcomes. People try to say that, what are the differences? People often get confused, maybe because of the way that they write it, outputs and outcomes, which is very confusing. So I have unpacked that as well afterwards, but let's get to this one first. Outputs are activities and participation. It is basically what you do, what you as an extension agent, an educator, you do. You conduct workshops, meetings, train the trainers, you deliver services, develop products, which is curriculum, different kind of resources for others to use and educate themselves. You provide counseling, you provide access, you facilitate different kind of activities that is going on in the community. You partner with others. You work with the media and now social media to get your work in front of people, in front of others. So you, and whom do you reach in the process? You reach the participants, those who are your people in your program, that they come to you. They attend your meetings, your clients, different agencies, government agencies, local, state, federal. We also reach them because we tell them that these are the important things that you are doing. And so whatever money you give, we are utilizing it properly. That is basically, we are telling them that. We are also reaching the decision makers, policy makers, customers, and we are providing this customer satisfaction to different people, our clientele, with our programming. So that is output. That is what is with us and what we are doing. When you go to outcomes, it is the impact, meaning what the society is gaining out of it, what the larger society, larger community at that point is gaining out of your programming. Then these are the kind of measurement. This is how we measure. One is short term, and one is medium term, and one is long term. And I do remember in our last meeting, Jackie was talking about these different terms in terms of timing. What are the outcomes? But again, not necessarily for one program, what is short term, that would be the same for another programming. One program could get their outcomes in 1 year. Some might take 5 years. Some might take 2 years. It all depends on the kind of programming that you are doing. So in short term, the learning, awareness, knowledge gained, changing attitude, brushing up your skills or knowing more skills, forming some opinions about something, aspirations, motivations. These are short-term outcomes. Did you change those things, those parameters? And that is short. That can be doable in 6 months to 1 year time, let's say. When we go to medium term, it is what are the actions you have taken based on the knowledge that you gain or what you learn from other programmings. Did you change your behavior? After, let's say, coming to your class, did they change their behavior afterwards? Did they change the practices? Have they started, let's say, drinking more water? Have they started exercising more or thinking about the nutrition fellow in different programmings? And have they changed? Has that been translated into policy changes? So if we have one policy, let's say in a school, have they changed it after you did the programming in the school or with the kids? Has there been any social action that has been taken? So those are more like medium-term results. And what are the ultimate long-term ones? Changes in the conditions in the society. That could be social changes, that could be economic, that could be civic, that could be environmental, or policies, or legal. Those are going to change in the society, which of course is long-term, but you can say at the end of the day that your work has contributed to that impact. And when we are thinking again through different stages, we also have some assumptions here and external factors. So sometimes you come up with a logic model, you think through your programming, and then it doesn't click, doesn't do the way you thought it is going to do, because that could be some external factors that are not working there, that hampered your programming. A big example would be COVID-19. So you thought, okay, yeah, I have all the immune, I'm going and just getting it in the community, but then the COVID happened and you cannot go in person. You as a programmer also struggling at that moment, like how do we cope with every situation? And then being resilient and developing and changing into different modes, those take time as well. So that is an external factor that happened and nobody had any control on that. So those kind of things. It's not always that, okay, I came up with this logic model, why didn't it work at the end of the day? Because there are other issues. So don't be hard on yourself. So assumptions also, you hypothesize different things. And maybe that is also changing. So yeah, these are some of the things that you think about. And always in the logic model, include your evaluation that we specialize in our unit. So you have that, how do you collect that measurable data to show your impact at the end of the day? That goes into your logic model. Like I should be collecting the feedback, or I should be collecting some written question, I'd be asking or conducting interviews. Anything that you do, you keep that data, whether it's qualitative, quantitative, doesn't matter. At the end of the day, what matters is the data and how you're going to showcase and analyze that. That again goes into the logic model. Okay, now let me unpack the difference between outputs and outcomes. Outputs are, again, what you did. You conducted some research, you got these findings, you developed methods, different models, new products, patents, plant, animal varieties, new practical knowledge. You also published, that is an output. You conducted workshops, courses, field trips, and anything that was also mentioned in the previous slide. These are all outputs. You're making presentations, you're writing blogs, you're going and making newsletters and everything. Those are outputs again. So then outcomes are how people benefit from your work. I did 5 presentations. So what? So that so what, when you answer that so what is the outcome? It is for the society. So let's say you're again talking about changes in learning, knowledge, attitude, and skills. Did we change that? Did we change the behavior or practice, policy making, decision making, and the changes in condition? These are again, I did 5 different things, and then I found that people have started consuming more water. They have started doing more, kind of exercise, and they have started doing different activities. Those are some of the outcomes again, and we need to measure that and list those for us to show at the end of the day that we made some changes. Okay, now when we were talking about short-term, medium-term, and long-term, here is again through pictures, is learning that is transforming to taking some actions, and that is again going to change in the condition. So let's say you go to an apple orchard and you start knowing about how to plant apple trees, or how to harvest better trees, how to handle the bug situation, and things like that. You first gain that knowledge, which is short term. Again, you're gaining that knowledge. You are learning something, and then you're applying that in the medium term, saying that, okay, we learned about A, B, C, and D, and this is what we have done. We have applied that in our own work, and that actually led to dollars gained, or people got better harvest. The farmers got better harvest. There was good value to the environment. There were different improvements in the societal conditions. There are other things that happened. That's why it's more like a chain, a series. But then you start from again taking baby steps and going and doing a little more, and then trying to change the society. We cannot in the beginning say that, oh, we are going to change every condition that is existing in the society. Okay, so now another important concept that I just wanted to introduce is the private and public value. What we value the more, how it is connected to logic model or the outcomes and what we are doing in the extension. Private value is program participant outcomes. There are 20 youth in your class, and you are teaching them something because you want to change their knowledge base, or you want to broaden their knowledge base. You are trying to tell them that if you do A, B, and C, and D, the living conditions are going to change. You are going to have some impact on the society, on the planet. And what they learn in the process is the program participant outcome, and that helps only themselves, their family, the immediate friends and all. But public is again long-term. which is more like what's happening in the whole world. It's a bigger one that is there. So let me give you some examples so you would probably see what's going on and what we mean by saying that. In 4-H, for example, you are teaching some of the classes, and by that, the youth stay out of court. They do not go there. They do not interact with them because your teaching taught them that they shouldn't be doing A, B, and C, and D. For the public in the same situation, what's the public value? Reduced court and human services cost is the economic gain. We are not investing that much of money or court's time because kids are staying out of the court. If we say similar thing in agriculture and food systems, growers use improved method and technologies and practices to get better harvest. And how it is helping the bigger society, the public, improved rural economy and environment. You are improving the economy. You are contributing quite a bit on that. So that is the broader outcome that is happening in a society. Moving on, let's say in environment, natural resources, water quality, education. The private would be you're saving dollar by reducing use of pesticides or herbicides. For public is improved water quality. We see that always right here in Chesapeake Bay, the condition, how all our like a majority of people in water quality education are into improving the water quality in Chesapeake Bay and related places here. In FCS, in nutrition education, or in SNAP-Ed as well, there are improved human health by increasing intake of fruits and vegetables or water, or by doing more exercises. For public, it's decreased healthcare cost. You're not visiting that often to the doctor. Maybe they'll not be happy with me, but you are doing the good thing there. And for the public, it is decreasing the healthcare costs for you. So these are some of the examples to see where we are going in terms of outputs and outcomes in different big programs. Moving on, now it's your job, how we are going to apply the logic model to your program development. So here we are going to do a breakout room, and Brad is going to create those rooms for us, and you would start thinking about how have or would, and now we know that you guys have already shared, some of you have been doing that quite a bit, even if you like or do not like, but you have applied logic model in your own program development. So how, if you haven't done so, you can start thinking about how would you apply that in your own program development. So we will have 10 minutes of time, and we can have, if 17 people, Brad, 4 groups for each?
Actually, it's 17, but there's really 14 participants plus the 3 of us. So I'm going to have 3 groups, and that'll be 5, 5, and 4. Okay, doke.
Awesome. Thank you.
And I'm starting the group. Actually, I'm going to first stop the recording right now, or pause the recording, excuse me.
To share what the discussion was and where it went. I went to one of them, it was really nice conversation, so I went out of it. So, okay, I'll stay out of that. Okay, so room 1, who was in room 1? Doris, you're muted.
Yeah, I believe I was in group 1 with Kelly and Gabrielle and Joy and someone else, Elena, was it? Anyway, and we were basically talking about the lack of consistency of the experience that any of us have had with logic models. We have said that what experience we've had with logic models seemed to be helpful. But some of us that have been around a little bit longer feel that this should not be an individual effort in a logic model. It should be more of a program team effort to make sure that we come out with the outcomes that the university or the state office is looking for, and not have an outcome be presented to us towards the end of the year to say, do you have this outcome? It's kind of like, whoa, no, because we didn't know that we should be focusing on that. We didn't try to set that up in our program or anything. But if we knew that we needed to collect that data, then we could talk about how to collect it. We would collect it. So we feel like sometimes we get surprised by what outcomes maybe would be most useful to the state and to the university. And we would like to be more involved in those decisions or those questions in the beginning of the year, or even the year before for IEPs, to get us focused in that direction. That's what I got out of what we were talking about.
Awesome. Yeah, of course, we do have another series, which is we will be announcing that Dr. Howard has that in the list. And we do have those sessions as well when we talk about the IEPs, what are needed and how things are changing, and if we need to change certain things. Because when we file the federal report every year, we do get these impact statements from all of you. And there are trainings to get those kind of impact statements that you guys have been writing, or others in your programs, and that they have been submitting. So we do get data from there that we again write it down the way that the federal agencies need to see, so that they continue their funding for us to do more programmings every year. But yes, if that has been the experience, we are here to change that. If you say that in the beginning, you need to tell us, or this is the timeline, and this is how we should get started, this is the data we should be collecting, of course, we are here to assist all of you with that. So thank you very much for bringing that in. Anybody else? Any other discussions? No coffee this morning, I think. Okay, so, well, if that is the case, let's take a quick break of 5 minutes, and then we can come back and resume and focus more on the outcomes and how to measure that. Thank you. Thank you, Brad. Yes. Okay, now let's quickly move on to our next segment, which is measurable outcomes. What are the things that we measure and why we should be doing that, given where we are located in University of Maryland Extension, what's going on around. So here is the SMART outcome. It's called SMART, where S is specific. State what you will do. Use action words. It is, again, if you're taking one objective, just focus on that from the beginning till the end, and then it is going to be very specific. If you say 10 different things, that is not specific, and then you create a hole for yourself and saying that, oh, I thought I can do 5 different things, but it's none of that is actually picking up. So it's always good to be very specific. Measurable, again, how do you evaluate your program? How do you get that data where you can show the impact? Just now I got that feedback, and the educators or the extension agents that I have been working on ever since I came into my role, we always discuss quite a bit about what kind of data you should be gathering, what are the ways that you can get data so that you measure it. You say at the end of the day, you go out there, do all the outreach, educate people, and come back, and then You do not have anything on the pen and paper in terms of the evaluation of your program that you can show everywhere. So from the beginning, again, and if that hasn't been happening, we can definitely be very proactive and start doing sessions to give this kind of training where you collect the kind of data that you need from the beginning to show your impact at the end. A is achievable. It's within your scope. If you are seeing others doing different kind of activities, not necessarily you will be adopting everything of that, which is achievable given the resources, given the community that you are going. Not everybody is working in one county. Not everybody is working with one community. There are different people. There are interdisciplinary research that is going on, different types of programming. So you need to first understand that it has to be achievable. You can do that, given your resources, your condition, you can do that. And relevant. If you are doing something which is not relevant to anybody, not saying that the programming is bad or something, but is it relevant to our communities, to our society at that point of time, to your programming, to your college, to the federal agencies, those who are giving money to do some kind of programming for us? Is it relevant for all of that? And then, is it time bound? You have everything right to say, okay, I will be doing this programming and all that, but is it, are you going to finish that in time? If it is, you said it is going to be 1 year, by 1 year, you would achieve A, B, C, and D, and then by 2 years end, you haven't done anything. So are you, is it time bound? Doris, do you have a comment to make?
I have a question for you, and I apologize. Could you, when you're finishing the time bound, can you touch again on the measurable use metrics or data targets?
Sure, absolutely.
Explain that part of that section again.
Absolutely. Thanks, Doris. Okay, let me go there because I was about to finish that time bound. We all understand that. Okay, measurable is what kind of data, evaluation data should you collect that you can measure? Did you interview people? Did you do any pre and post survey? Did you take some kind of poll when you are teaching a class? Did you do any of that to collect the data? Because that's where, whether it's quantitative, whether it's qualitative mostly comes when you talk to people, interviews, that is also very valuable data that we can analyze and include. And that is actually more utilized now and more meaningful because people talk in length, let's say, about your program. So do we have those systems in place? I have seen educators now when they come to me for one IRB, let's say, I would ask them, okay, this is your IRB, where is your questionnaire? When did you develop that? Don't you think you can change some questions that you can include this parameter and that parameter? And then we work one-on-one on that. And then they go for IRB, which is more like directing them to get relevant data, so which they can measure and show impact at the end of the day. So that is another focus, and we can discuss more about it and can have separate trainings on that as well. Okay, now coming to our situation, social situation. We are in a college. And within the college, we are the biggest department. And I think we are the biggest department in the university, if I'm not wrong. So the college comes up with different strategic initiatives. That is for 5 years, 6 years, they revisit again, maybe after 5, 6 years, depending on the strategic plan. However, if you see the plans or the strategic initiatives developed by our AG in our college, they actually include quite a bit of data points. and the whole process of building those initiatives. That has been done before, of course. There are a lot of people involved. There are a lot of people from different departments who are involved. And we are just not doing extension, we are doing research, extension, teaching, and all of that. So that's how they developed 5 different strategic initiatives. And these initiatives are informed from the critical issues that USDA establishes, or there is SCOP and ECOP, those kind of committees. Those are the national kind of committee which come together from different universities and funding agencies, and they say that these are the critical issues, because our data shows that we do have quite a bit of work here, but not here. And they would focus their work on those kind of issues. And when they focus, that means that they allocate quite a bit of money to that. And if we do that work, that money is coming to us. That's how it works. And at the end, when we write federal reports, we tell them that, okay, you gave us $5. We worked for a year, and this is what we did with your money. And then they approve it. They go through that and they approve it, saying that, okay, we see that whatever we paid for, you have done a good job. Take this money for the next year. That's how the whole system works, the federal, the state, and the funding that is going on. So based on all these data points, we have 5 strategic initiatives, as you can see here. Establish a healthy food system and ensure global food and nutritional security. Ensure a clean and healthy Chesapeake Bay. Advance innovative, profitable, and sustainable agricultural production systems. Improve human, animal, and environmental health. And optimize urban environments through design, green technology, and community engagement. And we have the next strategic initiative cornerstone event coming up next month, which would be focusing on these optimized urban environments and green technology. So this is how that comes down to us, to all the departments, basically, to make sure that all our faculty members, all our educators are working on some or the other critical issues to address those issues, to contribute globally, to contribute nationally. And that's how the strategy comes down to each and every state, each and every agent located anywhere in the state. So that's why we are doing. And when we collect that data, we are contributing to this bigger picture, to this place saying that, yeah, we have made some changes. We have made some impacts in those areas. Okay, so again, why it is more important to extension? Because we are the face of the university. We make a direct impact on the society. When we go out there, people identify us with the university. Those communities, those who have never been to a university, they would say that, oh, okay, extension is the first face that they see. And we are well equipped to make that difference. Not all the people, those who are working in different departments, go to a community. Not all of them. When they have integrated projects that they apply to USD and NIFA, they have this mandate that they have to include somebody from extension, come up with the logic model and all that, because they know that extension is the face. They are very well known in the communities, and they need to make them a part of their project in order to showcase that, well, we have good bonding with the extension, and that's why this is an integrated project. So we are very well equipped to make that difference in the society, in the community. And of course, we are accountable for the federal money. We know that this is the amount that is coming, and in the back end, that's what goes on, federal reporting and all these approval from NIFA and renewed funding for different things. Okay, Now again, we will do this fun activity and we will do a breakout room. Here it's for, let's say, 5 minutes we can do. And there you can list at least one intended outcome from your project. If you haven't started yet, you can think and say, this is one outcome that I need from my programming. Or you can go more than that. And we come back and share that among ourselves. Yeah. So Brad, would you mind doing the breakout rooms?
You bet. So there's, excuse me, there's 14 of you in these breakout rooms. I don't know if Deb just said it, are 2-person rooms. So you're working
2-person rooms.
one partner, and
Yeah.
hopefully this should work out. Let's try it out. 5 minutes, you said, right, Deb?
Yes.
5 minutes.
Thank you, Brad.
Okay, there we go. Okay, Charles, are you hearing me, Charles?
Yeah, I had the invitation and then it went away to go to breakout one.
Let's see. Do you see the breakout option?
Oh, there we go.
And you should be able to join from there, right? There you go. Good. Okay, everybody's in.
Okay, cool. Oh, recording is still on,
Whoops, sorry about that.
you know, chime in. So we have Kathleen and Gabby, those who were the torch bearers, and they're the first one to finish all their outcomes. They're going to share what they discussed and what they wrote down.
Sure. We kind of came at it from different perspectives a little bit. I'm in SNAP-Ed, and those that are SNAP-Ed can feel free to correct me, but we kind of have a pretty specific set of outcomes that we seek across the board for SNAP-Ed. How we implement it can vary depending on what our different collaborators are. But we have a certain set of like 5 actually main ones that are outcomes we kind of are seeking, whereas the Master Gardeners have certain direction, but maybe not as specific as SNAP-Ed does. So we definitely had kind of different perspectives coming at it from our outcomes or our intended outcome. Are we supposed to provide an example, or were we just supposed to talk about our
Just
thoughts?
outcomes. Yeah, you are absolutely right. We are aware of SNAP-Ed. They have common measures. They have the outcomes already set. But Kathleen, what's your perspective?
So like Gabriella was saying, it's like, it's open-ended. I don't like, one could be like, the outcome could be and maybe I don't know if I'm phrasing this correctly or not, but it would be like more native plants in urban landscapes, or more, I want to distribute X number of composting bins or something like that.
Okay, good. Yep, thank you. Anybody else?
I guess I'll kind of do it from, because most of my outcomes are actually on the larger scale. I don't have too many opportunities for short and midterm. There are some, and I know Jackie's in here, I know we've talked about some of them, but my project's very unique. We're talking about building capacity for domestic production of Atlantic salmon. So when we're looking at our outcomes, we're looking at most of our outcomes are things that can't even be measured for the next 20, 30 years. Because we're talking about like increased production of Atlantic salmon in the country. We're talking about decreased seafood deficit on the national scale. So a lot of my work, I can't even fathom, like it can't even be measured right now. It's and so when I can, I have to stop and look at, okay, so that's most of what I'm doing, But in between that, I am going to the state fair with a poster. And I am trying to explain to the general public about domestic, the domestic supply of food, which kind of does tie into the larger theme that, of food security in our country, especially post-COVID, and realizing that the supply chain is so fragile. And yeah, so I find it's hard to kind of do more of the middle ground, like the mid impacts. For me, it's the extremes. I can either do the result of a workshop or decreasing seafood deficits. I don't know if it's the same for everybody else, if it's the middle outcomes that tend to be more difficult, but I think for my programming, at least, that's where it's a little stickier.
Okay, thank you. Thanks for sharing. Yeah, we can definitely have a conversation afterwards to unpack it and measure it a year. Let's say in a year, what's your goal and what you're doing, what you have done to achieve that goal, and then move on to the next one, rather than, thinking about 20 years down the line, how you're going to build the capacity of some and all that. I'm familiar with the project, of course. And yeah, I see it on the other end, what is coming out of it. So yeah, we can definitely have a conversation on that. Okay, so Doris.
So I just wanted to comment on what you just said with following up from her talking about short-term, midterm, and long-term outcomes. And that is, so as we move forward and we're trying to put together that data for, let's say, a long-term outcome, and we're trying to send, I guess, like an evaluation to someone. In years past, we always had to have the evaluation approved and designed by a given person. Are we not doing it that way anymore? And if we aren't, does everyone have the liberty of creating their own evaluation, or what is the process that people have to go through to get an approved evaluation that we can send out for long-term outcomes?
So who was the person, Doris, who was doing the evaluations for you?
Well, it was T. T.
Okay.
McCoy she was the evaluation person, and there were all different levels of evaluation, and different things had to be approved and had to be all kinds of different levels of approval. That's why I'm asking. It's like, where do we stand at this point in time for evaluation tools, and who creates them, or how simple or how complicated they need to be?
Mm-hmm. So let's have a conversation, because there are a lot of people that I have sat down with to develop everything on their project, and they are collaborators all across different universities as well. So we have been discussing quite a bit, and I would like to know more about what kind of evaluation T has developed, and I don't see any common measures from my side that is existing or anything in use so far. So we can definitely touch base and discuss and see what you need and what has been the case, and how you will be successful and measure the goals.
And Deb, one piece to hop in on, I think, Doris, as you described, there's kind of probably several different things that are sliced in with what you're describing. Some of it is based on our history and our impact teams work and so forth. And there were some common survey instruments that were used so that we're all measuring the same components. And then those could be aggregated. So that might have been sliced in a little bit. Of course, any faculty member has the freedom to design and develop their own survey. The part of the other thing that may be slicing in the middle of that is, depending on the approach and the audience, then institutional review board process has to be followed, and that's part of the submission as an example. So those definitely had to be approved. So I think there may be a number of things that are coming together, but faculty members, they design their program and they want to measure the outcomes. They certainly have the freedom to design that, but of course we're here to help, to help advise and counsel. But as far as an approval process that might have been more connected with our university's IRB procedures and so forth. And then further, if there were specific things that the impact teams were looking to measure, we definitely asked that they use consistent survey instruments there. But we're your stop to do that. Deb brings that expertise in regard to evaluation and survey design. So it's of course still available for that. Jackie's got her hand up, I see. So
yeah, so we do have 2 minutes and to 12. And yeah, thanks, Erin. So people might have other things as well. So Jeff, would you like to make those announcements quickly, and then we can, get back to Jackie and other questions? Does that work?
Sure. Yeah, I'm happy to do that. Let me, we just wanted to draw attention to, we may start to show the slides again, but I'm going to just paste in on the 21st of September, we're hosting a individual extension plan IEP workshop. So you might have seen that notice that went out yesterday, but we did want to underscore or draw attention to it. It'll be kind of 2 components. One is going to be focused on utilizing the utility of the system to put an IEP into the system, and we'll just start through it. But it would be helpful to those of you that haven't participated in one before. The one we did last year, the recording's been up and so forth, but of course there'll be different perspectives with different questions and so forth. But the other thing is really working on all the things we've even talked about today. There's elements that are already built into the IEP system, which is basically a logic model. It's helping you to map out, and all the priorities are identified, and so you'll begin to kind of fine tune down into program specifics that you want to carry out. That's where you'll put your outputs. Of course, you have to know the outcomes that you want to lend toward, but we'll get into that. So we encourage you to sign up for that for the 21st. We will record it and have that available. And then the next thing we wanted to share is just to underscore our last session, which is set for October the 6th. It'll be face-to-face here in College Park. We're taking advantage of the ease of parking and access of the Maryland 4-H Center for you all to come to that. Unfortunately, not everyone would be able to come, but a direct invitation has already been sent to everyone that's part of our series this year. And so we encourage you, as you're available, to come to that. There'll be 2 training components. One's going to be on our DEIR focus, and then there'll also be a session on mentoring and so forth. But in the middle of all that also is the opportunity. Our senior administration will be joining us, and we'll have some recognition for you all for completing this series. We'll have lunch together. There'll be an informal time to get to interact. And then we have other components of our unit that will be joining to give update on what they do and what they contribute and so forth. So as we've drawn attention to, so look forward to having you all there. If you're able to join in person, we're surely hopeful that that would work out. It's a 10 to kind of 3 construct. So yes, we'll send out, Kelly, after registration, there'll be a code for parking and so forth, et cetera. And then of course, we'll take care of the meal and so forth. There's not a registration fee. So Jackie, I know you had your hand up if you wanted to hop in for a second.
Yeah, thank you, Jeff. And yeah, so for everyone, it's not like we are giving training, it's one time and it's done. We are here for troubleshooting. If you have any questions, concerns, or designing your survey, IRB, all these issues, we are here to support that one. So please don't hesitate to reach out to me or Jeff. Thank you. Jackie, sorry, you have been very patient.
No, that's fine. I just wanted to kind of address what Doris was saying and then put it in context of the logic model. So I think what's important is that as you're developing your logic models, you are thinking along the way of the different types and the timing of when you need to collect data. So when we do our outputs, when we're teaching, there's 2 different types of data that you're going to take there. You're going to take maybe your pre-class knowledge and post-class knowledge surveys. You're also going to do teaching effectiveness, which is separate. That's going to give you your short-term impacts or your short-term outcomes. Then you have to think, okay, post-programming, 6 months, 8 months, a year, 2 years, 3 years, surveying that same audience and saying, did you do what you intended to do? So you have to think about what those questions are going to be. And as Jeff said, run those through an IRB process so that you have them approved by the university. You can use them to publish papers. You can do that. That's what helps with scholarship development. And then some of those survey questions may get you to impact, which is that long-term, or depending on what behavior is, you may have the mathematical model from research that gives you what the impact is. So for instance, in my field, I'm going to teach a rain barrel workshop one day. I'm going to get pre and post information from the people sitting in class that day and their intention to do something. And then 6 months later or a year later, I'm going to survey them saying, did you put a rain barrel in? If they said yes, I know mathematically based on the research that every time a rain barrel is installed, that's 0.7 pounds of nitrogen do not get into the system and it improves water quality. I don't have to survey people for that. I have to survey for them. Have they done the work? Now, with that said, and Deb and Jeff can go like this, we encourage IRB. We encourage that the things are done. Do I send emails out to my people that say, hey, or a Qualtrics survey that's one sentence, one line, one question that says, you attended my class? Did you put in a rain barrel? Yes. Do I have an IRB for it? No. But am I using it for anything else but my own personal information? No. I'm not using it to publish a paper that requires an IRB. I'm not using it. I'm using it for my CV. I'm using it for my impact statement, but I'm not using it anything else. I would recommend, as an early career professional, put everything through IRB. Most of our old folks don't, because we didn't need IRBs when we started, but as a new professional, and that's the reason for the logic model, think about what you're surveying, think about the questions that you're asking, that you want to ask, and do those IRBs. And if you realize 6 months in, you need to add questions, Deb is great at helping you amend those IRBs. She's been helping me and Kathy Lou do that this past week. So that's what I would recommend.
Thank you so much, Jackie. So any other questions? Anybody? Well, thank you guys. Thanks a lot. Hope to see you in September in the IEP workshop and in October as well for our in-person meet. Thank you, everybody. Have a great day. Bye.
Thank you. Bye, everyone.